Hello, my name is Tatiana Pardo. I'm a physician. I'm a primary care physician, master in public health. I'm a healthcare quality improvement consultant and healthcare quality management advisor. And for the American Heart Association, I'm the board president for Kern County and Central Valley here in California. Sadly, about only 20% of adults achieve the recommended amount of physical activity. And as a physician, I know that inactivity increases the risk factors for death from heart attack, stroke, type 2 diabetes, and many others. For that reason, it is important to recognize that the physical activity that you do at work impacts your heart health in different ways than you work out outside of work. One of the theories is that when you are exercising in leisure time, you are stressing the body in very specific time of periods. In contrast, when you are working or you are at work doing physical activity, you are keeping your heart rate and your blood pressure in a high rate and because of your movement, because of your exercise. This is the first thing. So you don't have time, or your body doesn't have time for the recovery time that is important. For that reason, it's important that you go out of your work and start doing workout. The second one is because when you are working, you are under stress, and that stress affects your brain. So the only recommendation is as well, go outside and do different activities. It means that the physical activity out of work improve your sleep, your memory, your balance, and your body. As well, it's a natural mood lifter, and of course, keeps the doctor away of you. Next one, please. As a physician, we know that people who are not physically active, they are more likely to develop or increase the risk for heart attack and stroke, have obesity or overweight, and of course, high blood pressure, high cholesterol, high blood sugar, and the other risk factors. For that reason, we recommend at least 150 minutes a week for moderate or intensive aerobic activity, or 75 minutes of a week of vigorous activities. So what is the difference? When we say 150 of moderate intensity is like a walk, a good walk with a good pace. When we talk about vigorous aerobic activity is when you are swimming, when you are jogging, when you are doing like a greater activity. And the other recommendation is just combine both of them. Not all the time you should be running or jogging or riding bicycles, but you can walk as well, or doing like a fitness class, fitness class that works. But also, we also recommend the strength training activities. So the weightlifting is really important. And also we need to improve our balance and our endurance. So there are 4 different type of exercise that we recommend, that those are the strength, the flexibility, the endurance, and the balance. So it is not only run or not only walk or not only ride a bicycle or swimming, is to increase different other activities like yoga, for example, for your balance, the flexibility. So you need to stretch your body, probably at least a couple of minutes a day. So this is important. And of course, the other activities that I mentioned before. Next one, please. So there are different barriers that we as a health educator listen for the people. And is the one and most important that the people mention is that we don't have, or they don't have enough time to do the activities. So to address that one, we suggest monitor for a week your activities and identify the times open for the physical activity. For example, you can fit your routine in during the lunchtime. You can walk 20 minutes, or you can do the stretching while you are watching TV, for example. The second one is I don't have anyone to exercise with. So in that way, we recommend that you talk to your family, with your coworkers, and do a social support. Explain to them why do you need the workout? Why do you have to do that one, not alone, but with themselves? And you are going to help them as well to improve the physical activity. So the benefits are going to go through them as well. And the third one is, I don't have enough energy. So we know that some people have more energy during the morning time, someone in the afternoon. So you are the only one who knows when is the best time that you feel energetic, and you should schedule the activity time in those moments. Another important thing that I want to tell you is you don't have to do the 30 minutes or the 45 minutes when you are working in one time. You can segment, you can space or divide during the day all the activities, 10-15 minutes in the morning, 10-15 minutes in the afternoon. It is perfect, it's good enough, and it's the time you are at the end of the day doing the 30 minutes. And the other important thing is, when we talk about the 75 minutes or the 150 per week, it doesn't mean it should be just only in one day. Just try to do like at least 4 or 5 days during the week the activities. Why? Because this is the as I talked at the beginning, when you do, or when you don't have the time to rest your body, your heart rate and your blood pressure is going to be high. So if you segment during the days, different days, or you divide the amount of exercise during the weeks, you have the positive things for your health, because you are doing the peak of your blood pressure and the peak of your heart rate in one moment, and then you have the time for the recovery. And you are explaining and learning to your body to do this activity, these changes that are the positive and healthy changes. And the last one, please. And this is one of the important things that we don't have to forget, and is hydration. Hydration is critical for the heart health. And it's because when we are thirsty, we feel dehydrated. What happens when we are dehydrated? That our heart is pumping higher, and our arteries or our blood vessels are constricted, so are closed. So what happened? Our blood rate is gonna be higher, and our blood pressure is going to be higher, and that affects our workout. So that means that is not a good thing for our body. We are putting or overload our body, and this is not good. Also, our kidneys and our brain are going to be with a little bit of problems. So the most important thing is just drink, be hydrated, and the best beverage, as I said, is the water. Water is the best. Try to avoid all the caffeine beverages, because those caffeine beverages, the caffeine is a substance that is gonna just help you to lose through diuresis your liquids in your fluids of the body. So try to just drink water. And if you have any disease, like for example diabetes, or you have high blood pressure and taking diuretics, you need to keep that one in mind, and just increase even more the drink of water. So while 150 minutes of moderate physical activity a week sounds like a lot, I hope that those tips and solutions will help you to see how it can be broken down into more manageable increments and incorporated into your existing day. Thank you so much for this time, and I hope all those tips help you in your daily workout.